Hello everyone, I am Dr. Sarita Jain. In today's video, I am going to discuss about pregnancy pigmentation. There are two common terms about the pigmentation. One is melasma and second is chloasma. So what is melasma? Melasma is a common skin condition. It is characterized by hyperpigmented patches on the face. It mainly affects women and is often associated with hormonal changes. Chloasma is interchangeably used with melasma, but it technically refers to the pigmentation that occurs during pregnancy. The term chloasma specifically describes melasma occurring in pregnant women. Now, what are the causes and risk factor for melasma and chloasma? First is hormonal changes. Melasma is closely linked to hormonal changes, particularly estrogen and progesterone, which can trigger pigment production. This is why it commonly occurs during pregnancy and in women using oral contraceptives or hormone replacement therapy. Next is sun exposure. Ultraviolet radiation from the sun can exacerbate melasma by stimulating melanocytes. Melanocytes are cells that produce pigment. Next is genetic predisposition. Family history of the melasma can increase susceptibility to it. It also depends on skin type. Melasma is more common in individuals with darker skin type. Certain skincare products, specifically those with strong fragrances or chemicals, may contribute to pigmentation issues. Now, how to diagnose this condition? This condition can be easily diagnosed by visual examination and patient's history. Melasma typically presents as symmetric brownish patches on face, commonly on the cheeks, forehead, nose and chin. Wood lamp examination can also be used. This test uses ultraviolet light to help differentiate between epidermal, that is superficial, and dermal, that is deeper melasma. Skin biopsy is rarely needed, but it may be performed to rule out other conditions if the diagnosis is unclear. Now, what are the risk factors? This is commonly found during the pregnancy. Pregnant women, particularly those with dark skin tone, are at high risk due to the hormonal changes. Next is oral contraceptive pills. Use of hormonal birth control pill can trigger the melasma. Next is hormonal replacement therapy. Women undergoing hormone replacement therapy may also develop melasma. Next is sun exposure. Excessive sun exposure without protection is a significant risk factor. Now, what is the management and treatment of this condition? Most important is sun protection. For this, sunscreen can be used. Use broad spectrum sunscreen with an SPF of 30 or higher. Apply it daily, even on cloudy days also. Wear protective clothing. Wear hats and sunglasses to minimize sun exposure. Topical treatment can also be used. First drug is hydroquinone. It is a common bleaching agent that inhibits melanin production. It is available in strength ranging from 2% to 4%. It can cause skin irritation, redness, and it has potential for development of blue-black discoloration, which is called ochronosis. It should not be used in pregnant women without medical supervision. Next topical agent is tretinoin. This is a topical retinoid that promotes cell turnover and reduces pigmentation. It can cause dryness, peeling and sensitivity. It should be avoided during pregnancy due to potential teratogenic effect. Next is azelaic acid. It is a dicarboxylic acid that reduces melanin production and it has anti-inflammatory properties. It can also cause skin irritation and dryness. Next is kojic acid. This is a natural lightening agent that inhibits tyrosinase. This is an enzyme involved in melanin production. It can also cause mild skin irritation. Next is vitamin C. It is an antioxidant that can lighten pigmentation by inhibiting melanin synthesis. It is generally well tolerated but can cause mild irritation. Now, some procedural treatments are also available. Chemical peels are available that uses glycolic acid or other acids to exfoliate and lighten hyperpigmentation. Laser therapy can be used. This targets melanin in the skin to reduce pigmentation. Next is microdermabrasion. This is a procedure to exfoliate the outer layer of the skin and improve the pigmentation. Now, how to prevent this condition? For the prevention of this condition, best is sun avoidance. Minimize exposure to direct sunlight, particularly between 10 am to 4 pm, and also use regular sunscreen. Apply sunscreen daily and reapply every 2 hours when outdoors. Use gentle, non-irritating skincare products and avoid those with harsh chemicals. Special considerations are required during pregnancy and lactation. Melasma is common during pregnancy and many cases resolve postpartum. Treatment should be approached with caution, emphasize on sun protection and avoiding potent topical agent. During breastfeeding also, be cautious with topical treatments. Consult with the healthcare provider before using any products while breastfeeding. So this was all about melasma and closma. If you like this information, please like and share the video and subscribe my channel. Thanks.